Greetings, everybody. I'm Melvin Casey here at Casey Healing Wellness. I'd just like to take a few minutes just to talk about deep tissue massage versus Swedish massage. Recently, I wrote an article on my blog, the difference between the two services. And so the difference is that it's not about the technique, it's all about the muscle. And so what I mean by that is that Swedish massage focuses on superficial muscles. And that's the muscle that you just feel on the surface. So a good example would be like your trapezius muscle or your bicep. That would be a superficial muscle. Or your calf muscle is superficial compared to, let's say, your corabrachialis muscle, which is underneath the bicep. That's going to be a deep muscle. Or a soleus muscle, which is deep underneath the calf muscle. So those are the deep muscles. So those are the muscles that deep tissue massage will focus on. So that's really the difference. The difference is focusing on the muscle. And so deep tissue massage is very unique because it's one of those methods where you have to really take your time, okay? Because you're working with not only the muscle, but you're working with fascia as well. Okay, now if you don't know what fascia is that coating that surrounds the muscle. The best example I can give is if you take an orange, if you peel an orange, right? And as soon as you're peeling that orange, you see that that skin there. It's like that flesh part. That's the fascia. Or better yet, if you get like a chicken, a raw piece of chicken, and you know before you cook it, you see that sheet of thin fascia surrounding that meat. That's what fascia is. And that's what we have in our bodies. I say that to say because that needs to be worked on first, because what happens is that it hardens up due to whether it's injury or stress, knots, it hardens up and it hits the nerve, and that's what can cause pain. So you must work on that, because what it can do is that you can melt it. Just by technique, you can melt the fascia, and that way you can get in the muscle a lot easier. So that's what deep tissue is. It takes a lot of patience. Not only that, but you have to work into layers of the muscle depending on where the body is. Okay, some areas of the body has more than one layer of muscle, and so that's why you have to really take your time in getting it, and you have to really be relaxed. The therapist who's doing it has to be patient and take their time, and the client has to relax and can't be tense. Deep tissue massage will not work if you're tense. Sometimes it takes like 20 minutes just for the body to let go, depending on the person. So deep tissue massage, I suggest that you be very relaxed, and also I would suggest that you get them often, so that way the body gets used to it. But it's very beneficial, especially for chronic pain. Now, when it comes to Swedish massage, that's categorized as a relaxation, relaxing, smoothing, just relaxing, bringing the blood and the oxygen. Yes, it does that, but it can also get rid of pain as well. And so Swedish massage is beneficial for circulation, and it's beneficial for also blood flow. Now you remember, tendons and ligaments do not have their own blood supply. The muscle has the blood supply. So what you must do is bring the blood from the muscles into the tendons. And so that's how you prevent muscles being pulled. So when you tear a tendon, that's what they say, I pulled a muscle. So it's not really pulling a muscle literally, it's just the tendon is injured. So that's why Swedish massage is important, because you're bringing blood and oxygen to the tendons and the ligaments by certain techniques. So they're both beneficial, they're both great. And the misconception is that you can get a Swedish massage and get rid of pain. It doesn't have to be deep. And so they're both beneficial, but here's the thing. You have to be relaxed when you get a massage in general, whether it's a deep tissue or a Swedish massage. But everybody's different. Sometimes it takes longer for others to let go. But I strongly suggest getting massages periodically, because it's so beneficial to you health-wise. Massage will do wonders. It can prevent surgery. And At Casey Healing Wellness, we provide orthopedic massage and we provide muscular therapy. Muscular therapy is unheard of for most people, but I'm here to bring muscular therapy to the forefront. That is my specialty, and what that is, it's a combination of deep tissue, Swedish massage, and also myofascial release, along with friction. So if you're interested, hit us up, CaseyHealingWellness.com. We're also on Instagram, Facebook, and we're also on YouTube as well. See you soon.